We are recording, I think, Andrew.
Excellent. That's good.
I think we are. Anyway, let's go for it, see what happens.
Okay.
Andrew, thank you for coming on. Whereabouts are you today?
I live in Brighouse, West Yorkshire.
Okay, yeah, lovely part of the world, yeah.
But I'm currently in a car park in Marks and Spencer's Coach Centre. My wife is doing a shopping trip. Unfortunately, as a result of the long COVID, I can't currently walk any distance. So I'm just sat in the car really while she does that.
So how is your health now, Andrew?
It's not great. So right now, currently, what I'm experiencing is aches in all my muscles.
All of them?
Pretty much everywhere. Yeah.
Legs, arms, tummy.
Yes. Yeah. All those, which is kind of suggesting to me it's not actually the muscles, it's something else that's going on. Obviously, we don't really know what that is at the moment. Tiredness, the kind of brain fog that they talk about is there.
Do you get kind of a derealization as if you're not really quite there?
A little bit, yeah.
Yeah, kind of like you're watching yourself on a video.
Yeah, a bit of a surreal kind of experience. Yeah. The other thing that is quite there, and this was particularly bad yesterday, is I've got a sore throat that's been there ever since I've had this back in March, and a pain that extends kind of in my sternum, this bit of my chest.
Oh, almost going down into your chest.
Yeah, kind of down to the sternum bit. It's constantly aching. And if I try and do more, it ramps up, as does the muscle aches as well.
Does it? So the pain's worth. So the chest pain is worse with exertion.
It is. It almost feels like, you know, when you've got flu and everything hurts.
Yeah.
And aches. It's like that, but all the time.
Is there any pain going into your shoulders or your arm or your jaw?
No, not really. You're thinking of a heart attack.
Well, I'm thinking of angina type pain. Yeah.
Not that I can tell. One thing I have asked for, and I don't know if I'll get it, is an MRI of the heart, possibly the head as well. Because one of the things I've read is that longer term the heart shows damage. There was a study I read that said 78% get this. So it's one thing I've asked for to see if that is possible for me.
So you've had all these features since March.
Yeah.
So March, April, May, June, July. So we're 5 months plus, aren't we?
We are. So I originally came down with this back in March, and I was pretty much bedridden.
Late March, Andrew. When was it?
Well, this is where it gets a little bit unsure, because I first became ill early March with very much flu-like symptoms.
Early March,
and towards the end of March, I thought I was getting better. And then the 28th of March, I'll never forget the date, bam, suddenly it hit me like flu, but 10 times worse.
So you felt really ill?
Really ill. And I was effectively bedridden from that point onwards.
Did you have sort of cough and fever and things like that?
Fever, weakness, just out for the count, really.
Yeah.
I had moments where I felt as if I couldn't breathe. I had the medics out a couple of times. They did various tests. The one thing that never seemed to happen for me was that my oxygen seemed to remain consistent. And I ended up buying one of those oximeter.
Yeah, sure.
And it's constantly told me 98. If I at that time, if I they got me to walk down 2 flights of stairs and back up.
Yeah.
Dipped a little bit, but it came back.
What are these things?
That's it. One of those, exactly.
Yeah.
My pulse. Again, I've read lots of people like this. Other long haulers, it absolutely races when they try and do something.
Yeah.
Luckily, so far, I'm not experiencing that. My pulse, yes, it goes up. Now, I used to be able to go for long walks. I did it regularly, once a week, if not more.
Yeah.
And my average pulse was about 90.
Yeah.
Now, if I even have a shower, I had a shower this morning, and my pulse, it says it was 165 briefly. I'm not sure that's accurate, but it was averaging.
You are getting the pain when you exercise as well.
Yes, and any kind of exertion, and it all ramps up. Basically, I have to sit quiet all day. That's the only way.
And it's been like this since March, Andrew. That's awful.
I started to get up again towards the end of April. Ever since then, this is what I'm feeling, yeah.
Were you officially diagnosed with COVID-19? Did you get the test at the time?
I had a test at the end of April, the swab test.
Yeah.
And that came back negative at that point.
Of course, you'd had it for a month at that point already.
Yes, exactly.
Yeah.
I have asked for an antibody test. So far, I've not been able to get that arranged, but I am concerned whether it will actually give a true reading, because the other thing I've learned is that a number of people after so many months, the antibodies disappear.
Well, if you had the active infection at the end of March, April, May, June, you would have expected your antibodies to disappear by July anyway. So you would need the T-cell test. You'd have to ask the doctors for the T-cell test.
Yes, my understanding is that that's a lot harder to.
It is, and I'm not sure that GPs can order it, but it's up to your GP to work out how the heck he's going to do that, because that's what you need.
Yeah.
So basically, did the doctors clinically diagnose you with COVID at the time?
Yes, my GP, he won't put COVID on my sick note for work.
Yeah.
He's put kind of fatigue, weakness, because they can't absolutely prove that this is what I've had.
Yeah.
They won't actually put it, but symptomatically wise, absolutely everything suggests that this is what it is.
So going back to the original illness, you had fever, you had weakness, you had shortness of breath. Did you have muscle aches in the acute phase in the beginning?
I can't really remember. I don't remember it.
Yeah.
But then on the other hand, because I wasn't getting up,
sure.
I'm not sure whether I knew anyway at the time.
Did you have any sickness or diarrhea or vomiting?
No sickness, diarrhea a little bit. Even now, it's not diarrhea, but it's not. It's, how can I put it? It's looser than it should be.
Yeah, it's not quite normal. Yeah.
Yes.
Yeah, sure. Did you ever test your sense of smell, Andrew?
As far as I know, it's always maintained. As far as I know, I've never had that problem.
Of course, back in March, this wasn't a well-known clinical feature. Actually, it was. We only became aware later on. Did you have a rash of any sort at any time?
I have had. Oh yeah, I've had the COVID toe. I've got pictures of my toes where that's come up. Thankfully, that's gone away since. I have had some rashes on my, kind of below my chest, on my abdomen, which are still present a little bit. Yeah, they're still there now.
I mean, it certainly sounds very much like COVID. You had the weakness, you had the fever, you had the shortness of breath. How was your cough? Did you have much of a cough?
Not a full-blown cough. I have got, I don't know if this comes across here, even now I've got a sore throat, which, again, the more I exert myself, even as simple as unloading a dishwasher, I can get coughing fits from it because of the weakness that it causes.
Irritation, it does sound suspicious. But the bottom line is here, you're a fit bloke on the 1st of March.
Yep.
And by the 1st of April, you were basically grossly incapacitated.
Exactly. I mean, I was always one of the people at work that never got ill, that was always there, that pushed through.
Yeah.
And I'm effectively housebound since then.
So you're dependent on your wife for cooking your meals and making your cups of tea. And
I can do very basic stuff, so I can make a cup of tea, but because going up flights of stairs hurts, I get down to the kitchen on the morning, and I more or less stay there for most of the day, because going back up hurts.
So if you went back upstairs, it would be painful. You get a very fast heart rate. Would you feel very tired and exhausted doing that?
Yes, I feel it on the backs of my legs.
Yeah.
Kind of it's the pain increases, and and the tight chest.
And does it make you short of breath when you go upstairs?
I haven't had that so much. No, I mean, because I'm doing everything really slowly.
Yeah, you don't push it. Yeah.
Yeah.
You know your heart rate goes up because you put that heart meter thing on in it, and you can see your heart rate is 160.
It does, but again, I'm deliberately trying to. I've got an Apple Watch, and that keeps a constant monitor. So I've read this thing about trying to keep it really low. So I try not to do anything that's going to exert it too much.
Yeah, but I mean, 160 after having a shower is clearly not a normal situation, is it?
No, I mean, that was very brief. It went immediately down to about 110, something like that.
Okay, yeah.
It was just a quick spike.
Yeah. So we're calling this long COVID, Andrew. Is that basically is this kind of getting on to be a recognised diagnosis now?
Well, I'm on the there's a Facebook group, and I think there's about 18,000 people on there, quite a few, and I'm on there, and I find that quite a comfort to see that you're not alone, that there are lots of other people in this situation.
And does their experience ring true with your own experience?
Absolutely. Very, very, very similar situations out there. And a lot of people like me that were previously well, healthy, the go-getters of this life, who suddenly are reduced to, well, a bit like me, they can do very little.
Yeah. Can you read like an article in a proper newspaper, and how's your mental processing, your intellectual function?
I mean, I get tired very quickly. It doesn't take much to feel the exhaustion. Luckily, I seem to be reasonably okay. I still feel like I'm me, and that I can still reason things. I mean, one thing I did find early on, and it's still there a little bit now, is my emotions are much more at the surface than the
emotional ability.
I'm normally quite a logical, ordered kind of guy, but I find that the emotions bubble up really quickly. And I remember reaching out to a professor at the time, Paul Garner. I don't know if you've heard of him. He's come up a few times in. He does quite a lot of interviews that I've seen on like national TV.
Yeah.
And he's also been mentioned in a recent journal in the BMJ.
Right.
He's fed into that, which was the article that said, "Don't push it. Don't do this graded exercise."
Yeah.
Because one thing I tried really early on, this is back in May, I assumed it was just going to be like some normal recovery.
Yeah.
You feel a bit ill for a few weeks,
yeah,
and you slowly get better. So I tried going out for some walks, very short, very slow, and I managed it 3 days in a row. And by the third day, I collapsed. Almost literally.
Yeah. It's not something you can train your way out of. You can't work your way out of it,
It would appear not. There's a bit of me that thinks, should I try it again? But when I read what other people have said, the general advice seems to be rest, rest, rest. So I'm just trying to, take it easy.
I mean, this started in March. Is it a little better than it was? Is it slightly worse? Is it slightly better? Is it exactly the same for the last 5 months? What's the trend?
It feels to me the same. Certain things have got better. My COVID toes disappeared. I'm not getting new rashes. It's just the same as it was.
Yeah.
So,
but
it feels
work's not improving really. The ability to exercise.
No, doesn't feel like it is. No.
Has your GP referred you on for things like cardiological opinions and?
The GP has put me forward for a number of blood tests and an X-ray. The X-ray came back fine. This was back in May, I think it was. The blood test initially showed a couple of increased markers for the liver. Bilirubin, ALT, they were raised.
Yeah.
He got those redone about a month, 6 weeks later, and those are dropped.
Good.
Any
heart markers, Andrew? Any cardiac markers?
No.
Right.
No.
Good.
As in, did it come back with any?
Yeah, you didn't have any troponin or anything like that indicated you might have heart damage.
They've not really done any tests for that. It is something I've asked for. Because I've read somewhere that there is a high probability of heart damage. I think somewhere I read 78%.
Yeah.
So I've asked if it's possible for an MRI to.
Yeah, and what would be very useful is a sound scan. A sound scan of your heart. Yeah,
that's something that I can ask for.
Just the ultrasound, the ultrasonography, the same, similar to the do for looking for unborn babies. Then they can actually, they can actually see the heart moving and see the way the heart beats. Echocardiography, it's called.
Okay, I do have an appointment with the hospital. On the 4th of September, a couple of weeks' time.
It's very frustrating. It takes so long to get around them to these things, doesn't it? You're sort of waiting for ages, waiting for a.
I mean, it's difficult. I mean, the GP, he's being supportive and he's trying to be helpful, but the difficulty he seems to have is that because there isn't a test, because there isn't any kind of specific
diagnostic test.
Do this and you'll feel better. It's a little bit difficult for them to say, do this and that'll help.
There's not a chapter in the textbooks. Doctors are a bit rubbish, actually.
Would appear so, yes.
If they can't put a name on your disease, if they can put a name on it, then they're fine. They can look it up and.
Yeah, I mean, what is said back is that probably 5 years from now, they'll know and there'll be certain things they can advise.
Yeah.
This is what he's said. The problem is that right now is when I need help.
Of course.
And they don't know what help to provide, seemingly. I mean, I'll know more when I have this hospital.
Yeah, I mean, it's obviously worth seeing a physician as soon as you can, but I mean, to be exactly the same for the last 5 months without any improvement it must be emotionally very difficult.
It is, as I say, my emotions were very elevated, particularly a couple of months ago. I think that's calmed down a bit since. I've maybe got more of a grip on that. This is, this is normal. I think to feel this physically ill for so long, it's bound to have an effect on you.
Oh, any illness can cause depression, of course. Any illness can.
Yeah, exactly. So I have.
You could say you're in a group. There's a cohort of people like you. You're not on your own in this, are you?
Exactly. I mean, I have these moments where I feel a bit. Is this it? Am I going to be stuck like this for a long time, forever, kind of thing? You do worry. Is this what it's going to be like for me now?
And of course, as of now, we don't know. We don't know that, do we? This is the difficult thing. I mean.
Exactly.
Is there any data coming out of long COVID people dramatically improving, or do some people in the group say, "Oh, I'm a lot better than I was last week"?
Yeah, some people. I mean, it's funny because you get these comments by certain people at certain weeks.
Yeah.
Say, I suddenly feel so much better.
Interesting, right? Okay, that's very hopeful.
But then they also have a lot where some relapse. They maybe push themselves.
Right. Some people get better and then they seem to relapse again.
They seem to push themselves, and then that causes them to go backwards again.
Right.
So, yeah, I don't know of anybody specifically on there that says, absolutely, I've got better and I'm out of it now. Maybe the odd one or two. Yeah.
Right. Okay. Yeah. So, I mean, we're very much hoping for the best situation here, Andrew, aren't we? I mean, it's
very much so. I mean, I want my life back. I want to get back
to work, and
Yeah. I enjoyed my life. It was
cool.
A good job, etc., etc. I enjoyed. And if I could wave a magic wand and be back there again today, I would be.
Yeah. Well, Andrew, I wish you the best. I'm sure everyone watching does. And
thank you.
It's very, very likely you've got this long COVID syndrome. And I think one of the ways that we'll start combating this is people with the courage, such as yourself, to talk about this, and then other people can say, "Oh, just a minute, maybe I've got that as well," and get that group together. Get a cohort.
Yeah.
It's only when you've got a good group together that you can start doing proper research and collect the data and work out what the best thing is. An individual on their own is pretty useless in terms of medical research, but a cohort, if there's several hundred people, and it looks like there are. I mean, what kind of numbers do you think we're talking about over the country, Andrew?
I don't know. I mean, I know there's 18,000 in this. I think it's about 18,000 in this group.
Is that international or mostly UK?
It is international, so and the group membership isn't just people that have the illness; it's also people that are supporting them with the illness.
Yes, of course.
So,
family members, friends. Yeah.
Yeah, the other thing is that I've heard some evidence from this. There's the app, isn't there, where people are logging
the
there.
COVID symptom tracker app. Yeah.
Yeah, I'm on there every day logging my symptoms.
Me too.
Excellent.
Right, so Tim Spector's following you up, is he? That's good.
And I think it says on there that there's roughly, is it somewhere between 5 and 10% that are experiencing this for a long period of time. So
an awful lot, isn't it?
It sounds like it. Yeah.
I must say I wasn't aware it was people were as debilitated as you are at the moment for five months plus. In fact, it's heading on for 6 months now, isn't it?
It is. I mean, I don't know. I might be an outlier. It's difficult to know. I've no.
That's why you need the cohort and the COVID symptom tracker app to tell us that.
Exactly. Yeah. So I keep filling it in every day, and hopefully something will come out of that. That will help.
And I know we talked before. You're doing everything you can. You're thinking about your nutrition. How's your sleep? Are you sleeping okay?
Sleep is mixed. I tend to wake up a number of times. I always seem to drop off to sleep okay.
Yeah.
But then if I wake up in the middle of the night, sometimes it can be quite hard to get back off again.
Right.
Luckily, because I am off work at the moment, if I do have a bad night's sleep, I can have a lie-in and try and catch up a little bit. I went to bed
okay before you had this problem.
Pretty much, yeah, just kind of normal.
You could almost say that this sleep difficulty is one of the features of the long.
Appears to be, yeah. It appears to be. Oh, sorry about that. Radio just came on. Just turned it off.
I thought it was your wife arriving back from the shop.
Yeah, she's back here now. Yeah, she's back in the car.
Yeah,
ready to take me home.
Yeah. Andrew, as always, what I do with these videos, I post it privately. If you're happy with it, fine. If you're not happy with it, we scrub it.
Okay, no, that'd be really good. Yeah, thank you.
But whatever you decide to do, I still feel there's a lot of people in your position that we need to bring this out. We need to talk about this, and hopefully that's going to lead forward to to real treatment strategies that are going to help a lot of people.
Hopefully, yes.
Yeah, indeed. Right. Thanks, Andrew. I appreciate it very much.
Yeah, thank you.
Thanks. Right.